Thank you very much for having me here. The first name is Usman. The last name is Yusuf. I see many people shifting it. So they say, do not give me the microphone. It's like giving a preacher the microphone or a teenager a cell phone. So Sani, wave at me when I'm talking too much. Ladies and gentlemen, my story is this. I practiced in Nigeria, went to the UK, so I saw the dysfunctional healthcare in Nigeria. Went to the UK, and I saw the non-inventive system in the UK. I was looking for the perfect system. I went across the pond, went to the United States. What I saw there was the wasteful but inequitable system in the United States. I even went as far as Cuba, looking for the perfect system. Didn't find any. Why I kept going all over the place is because of the nomadic genes in me. I'm finally back home to help make the imperfect perfect. So I'm home now. From clinical and bench research, I'm now selling insurance. Can you feel my pain? So when I was given this job, like many of us, none of us applied for these positions. Never met the president. Gave me this job. I took this job with a sense of humility. Of the millions of Nigerians that are many, a lot more qualified than me, I was chosen. Whoever recommended me saw something in me to come here and make a difference. I said a silent prayer, made a promise, not to the president that appointed me, but to our Creator, that I'm going to be a good steward of that which I'm entrusted with, which is our people's commonwealth. So help me God. Came to the NHIS. Situation analysis. The one reason the NHIS survive and it is there is one, universal healthcare coverage. We like slogans. You hear a lot of people saying universal healthcare coverage, universal healthcare coverage. What does it mean? What it means is that all the 170, 180 million Nigerians should be covered. What did I find? I asked, how many Nigerians are covered? Show me a number. Nobody has that number. There's no Nigerian that will pick his holy book and tell you, I swear by this number. I know what I pay HMOs for, 2-point-something million enrollees. Ladies and gentlemen, 2-point-something million in 12 years. And a very good 1/3 of those are ghost enrollees. So ladies and gentlemen, in 12 years, we have covered only 1% of Nigerians. And I told my people in the NHIS, if NHIS was a business, it will go bankrupt. If the basis for the big black SUVs we drive in and the fat paycheck we get are the number of enrollees, we should be riding on keke napep and eating Indomie. We've not earned that. People, I wasn't brought here, Chikwe wasn't brought here, Sani wasn't brought here to play the politics and be politically correct. We're here to make a difference. And we as Nigerians need to stop deceiving ourselves and not lying to ourselves. We have been abysmal failure as an agency over the last 12 years if the yardstick is how many Nigerians have we covered. What is universal healthcare coverage? It's a noble ideal. At its core, what it says is that every person, regardless of his station in life, rich or poor, regardless of whether he can afford to pay, regardless of whether he's employed, has the right, is entitled to good quality healthcare. And that good quality healthcare is not only a human right, but it's a tool to alleviating poverty. Many of us, myself included, we live a paycheck away from poverty. A major illness will wipe away all our savings. And all of us, we go back home to our ancestral homes. Who have we left back home? The people we call the vulnerables, predominantly the aged, widows, widowers, women, and children. Many of them sick. When they get sick, they stay home or resort to herbal conks. Why? Because they cannot afford to go to hospital. That's where NHIS should come, to help people access healthcare. World Health Organization gave 4 recommendations for government how to fund universal healthcare coverage. The first recommendation is governments should reduce the out-of-pocket payments for their people. In Nigeria, it's about 60, 70%. You go to hospital, you pay out of pocket. Number 2, government should maximize mandatory prepayment. That is, make health insurance mandatory. Number 3, deepen the pool. Increase the pool. And number 4, government should pay for those who cannot pay for themselves. The whole idea of health insurance is a noble one, that we, the healthy, take care of the sick. We, the strong, take care of the weak. And those who have, take care of those who do not. Very simple. It's there in all our cultures, all our scriptures. Unless we have a lot of people in the pool, we cannot pay for them. So, ladies and gentlemen, where have we failed? These were my options. 1, pack my bags and go back home where I came from. 2, just say, this is Nigeria, it happens this way. 3, partake in the buffet of corruption. For me, none of these, like many of you, none of this is an option. What I have done is to take the path of honor and do the right thing and fight corruption. And that's why corruption is fighting me, by proxy and frontally. Ladies and gentlemen, we cannot, this is corruption in Nigeria, it is today. Those of us that have lived this long know this is not who we were, but who we have become. And we're all resigned to saying we cannot change it. We can. It takes few committed people to bring change. And we will. And they will fight us. And we are fighters. And we will fight. Our constituency is our people. We in the parastatals, for the first time in this country, we're friends. We talk to each other. Even before we assumed, we were doing conference calls, and somebody's in South Africa, Germany, Vegas, UK. We're talking to each other. We go to dinner. We realize each one of us, we are just pieces of a large puzzle. None of us. NHIS is nothing without primary health care, or NACA, or CDC. What I realized when I got here, that this agency, more than many, the NHIS, has the potential to make an impactful difference in the lives of our people. Only if that potential is harnessed well. It's not been. It's not been. Countries like Ghana, Rwanda, and Kenya, all of them put together, do not have the human or capital resources we have covered 50 to 60% of their people. Verifiable. I go to conferences and the Ghanaians will be showing numbers. Oh, how many are covered? How many are enrolled now in Tamale? How? My turn comes to speak. So, ladies and gentlemen, I cannot lie because I do not know how. But I'm ashamed. Our number in Nigeria is abysmally low. Anybody that comes and tells you 4 or 5% doesn't know what he's saying. I sit there and write the checks. I know it's 1%. Even that 1%, I cannot lift my holy book and say, this is the mess I found. People, are we going to continue this way? No. NHIS has enough resources to make a difference in the healthcare sector in Nigeria. This is the scorecard. I will score NHIS, HMOs, hospitals, and our politicians. So, ladies and gentlemen, I've had the honor to see healthcare across the globe. Healthcare financing in Nigeria, what I saw, like they say, where my eyes see, my mouth no fit talk on. Ladies and gentlemen, what I saw in healthcare financing in Nigeria is nothing but subsidy to HMOs. They speak the truth, because the truth shall set you. So I will give you the scorecard. NHIS. We as the regulator, we've been sleeping on duty for 12, 13 years. We've been complicit with HMOs and politicians to pillage the healthcare financing treasury. Inefficient, and just sitting there and handed over everything to HMOs. My mandate was crystal clear. Go make the NHIS work for all Nigerians. There's no way you can make the NHIS work for all Nigerians without cleansing the NHIS of corruption, inefficiency, impunity, and political patronage. But above all, you must be a good custodian of that which you entrust you with, which is our people's commonwealth. Ladies and gentlemen, NHIS money is not some federal government capital allocation. It is money paid on behalf of people, those that are working, or those that voluntarily pay into the pool. This is what makes it a bigger trust than if I was working in a place where we have government allocation. NHIS, I'll be the first to tell you, the NHIS I met is not the one that you should be. I'm changing that. I'm telling people this is why we're here. And the changes, what gives me strength is I come to work and I see letters from the little guy. From Umuahia, from Nnewi, from Sokoto, written in perfect English, but the message coming crystal clear, thanking us for fighting for them. That's why we're here, for the little guy. That's why we're here, for the little guy. All this time, the little guy has been lost in the shuffle. I am going to be, and I've told everybody, the executive secretary of the enrollee. There is nobody in any government agency that will tell you they chose their HMO, just like you chose your bank, or you chose the gas station you go and fuel your car. I am the executive secretary of the NHIS. I have been handed over to an HMO. Nobody asked me. They asked me, oh, which bank? I say GT. Which this thing? I say that. But nobody asked me which HMO. They've handed me over to the HMO. So what reasons do HMO have for improving their services? The problem starts with HMO, with NHIS. That's why I'm cleaning NHIS. NHIS, I will tell you, is one of the few organizations in this country with very, very professionals from everywhere, with doctors, nurses, midwives, pharmacists, lawyers, engineers, accountants, auditors. They've been misled. I am now remotivating them, redirecting the ship, tell them why we are there to serve the enrollee, and to be accountable for whatever we do, and to reduce wastage, people's money. Each time they come and tell me, oh, Oga, it's your entitlement. I say, no, it's enrollees' money. So we are, NHIS, shining the light on ourselves. Unless you blame yourselves, I cannot go out and blame HMOs or hospitals. Go to HMOs. I've seen HMOs. I came from the land of HMOs. NHIS, whoever knows America, is like Medicaid or Medicare. It's not for profit. In America, Medicaid or Medicare, we don't take our money and give to HMOs. In Nigeria, this is what happens. We give lives. Lives are the number of people to HMOs. We give money to HMOs. What do? We used to give them money 3 months ahead. I don't know if any one of you in this room gets paid 3 months before delivering services. Pay them 3 months ahead to pay on behalf of enrollees and their families when they go to hospitals. Many of them do not. Many of them do not. So our patients, when they go to hospitals, they do not get treated with the dignity and respect they deserve. Why? Because HMOs have not paid. Billions. So when I came, I asked my people, gather HMOs in Abuja for me. And I asked them, pull the debt, the money they are supposed to pay the NHIS first. It was over 1.3 billion. They came at the gate and give them, oh, this is a message from the ES, this is a message from the ES. And I wrote to them, HMO A, you owe the NHIS this much. Pay back by December. If not, I will delist you, split the number of lives you have, and take legal action to recoup my money. I'm happy to tell you that NHIS has recouped over 95% of the debt owed them. Next, what I have done, what I am doing, I have deployed my people nationwide to collect debt, owed hospitals nationwide by HMOs. And I will get that money back from HMOs and pay hospitals. The reason is I went to, first time I addressed Committee of CMDs in Calabar. And I told them, many of them were my students, all of them are my friends. And I told them, ladies and gentlemen, I'm in the midst of friends. I can take some liberties here of telling you guys the truth. The truth is you do not treat our patients well in your facilities. We went to medical school to do good. This is not the oath we took. He stood up. The chairman said, guilty as charged. Why teach in hospitals? Because they see the most of our patients. What I hear consistently from them, from all hospitals nationwide, is HMOs do not pay us. And we're having difficulty with funding our operations. That is why I want to take that excuse off the table. HMOs nationwide must pay hospitals. I'm reaccrediting all HMOs nationwide, and this is breaking news for those who want to go and tell their HMOs. I am reaccrediting all HMOs in July. One of the conditions for reaccreditation is you must have a certificate of freedom of non-indebtedness from all hospitals you serve. You're free of debt. How many hospitals do you serve? 1,000. Get a certificate signed by the CMD that you do not owe them anything. Because I'm tired of having to fight to get this money on behalf of patients or on behalf of hospitals. Nigeria is our country, all the 170, 180 million of us. Majority of HMOs live in Lagos, Victoria Island, Ikoyi. They did not get the memo that the federal capital has moved to Abuja. No, it's annoying because patients in Arugungu, Umuahia, Arondizogu, Ikpere, they have to call them from Lagos. Give me a break. You must serve your people, accountable to your people, close to the people. I'm cleaning the system, and they are fighting me. That's why we're here, to make a difference for the people we serve. HMOs have not been paying, I'll make them pay. HMOs, I'll make them accountable, and they will be. There are many, all HMOs now, no HMO has a valid license. Some have expired as far back as 2013. And all of them has expired by December 2016. Will the central bank deal with a bank that does not have a license? Will you practice in the hospital without a license? The failure is us. We've been complicit, us, NHIS. I'm part of it now. That is why I'm doing all this reaccreditation in July. HMOs, I've told them, sit up. There's a new sheriff in town. It's not going to be business as usual. Hospitals. Because we are a tripod, NHIS, HMOs, and hospitals. And the enrollee lost in the shuffle. Hospitals have their own problems too. Wherever I go to Umuahia, I go to Owerri, I go to Katsina, Kano, I go to Sokoto, I go to the teaching hospitals. What I see, ladies and gentlemen, is heartbreaking. Delivery room. A woman giving birth, roofs leaking. I'm a pediatrician. I go to pediatric ward. A mother holding her sick child. She does not even have a place to lean her back. This is the health system we meant. We cannot allow to continue. That is why the NHIS, for the first time in the history of the NHIS, we are doing intervention to federal tertiary institutions across all 6 geopolitical zones, 7 hospitals, federal government hospitals. And we will hold each hospital accountable. What I'm trying to do is improve, because the CMDs come to me and say, Oga, you're planning to increase the number of enrollees. If you do that, we may not be able to cope. A pregnant woman will go to hospital for antenatal care at the crack of dawn. She won't be seen till dusk. Guess who she will blame? The NHIS. That's where we are. And I see, in spite of all our failings, the NHIS, I have seen the difference the NHIS has made in healthcare in Nigeria. People who have lived in Abuja longer than me will tell you the coming of NHIS has increased access into the national hospital. And every hospital I go, there's a huge building NHIS. We want to now help big tertiary hospitals. Why those? Why not primary healthcare? Primary healthcare should be the foundation, the bedrock of our healthcare service. NHIS is a contributory scheme, just like PENCOM. You contribute, you benefit. The largest number of enrollees are seen by our teaching hospitals. This year, what I'm planning is to do these interventions in these large tertiary hospitals, improve infrastructure development in the hospitals, hopefully improve access. And then next year we'll see what can we do. All this is from people's money. People that have contributed, they're using that money to help other people. Politicians don't see the NHIS as an ATM. NHIS is one of those noble institutions in this country that should not be allowed to die. That should be strengthened. A very good, robust NHIS should be able to fund our meningococcal outbreak. Because we have component of reserve, where we should reserve the money. Monies we don't use. We should be able to fund our HIV patients from people's contribution. If only it is harnessed properly. If only we deepen the pool. I am going nationwide. You will see me from the edges of the Sahara to the creeks of the Niger Delta, selling this noble institution that should not be allowed to die. Its survival not only has implications for the welfare of our people, but has national security implications. Why? Because we served all uniformed services and security agencies. Our gallant men and women in the front, to whom we owe a debt of gratitude. We pay for their health insurance. Survival of this agency and us doing the right thing is our way of saying thank you to them. 3 things I'm going to do. Accountability, accountability, accountability. Whatever you do, throw money, you're throwing good money after bad. I must hold everybody accountable, from the NHIS to HMOs to hospitals to our elected representatives. Accountability. Increase coverage. Ladies and gentlemen, we have 99% of Nigerians that are not covered. We have work to do. And who are those not covered? Vulnerables. Pregnant women, children under 5, the aged, IDP, disabled, the unemployed, prisoners. These are our people, majority of our people, not the small percentage of people we have in Abuja, Lagos, or Kano. Accountability, number 1. Increasing coverage for our people. Because I've asked Nigerians, the only way you can judge me is how many more Nigerians have you covered? Number 3, explore more creative ways of funding healthcare financing in Nigeria. We have a program in the NHIS called VC-SHIP, Vital Contributor Social Health Insurance Program. How much does it cost? 15,000 naira. That is $33 annually. For that much, you can cover a person will enjoy healthcare access as I would. Every one of us can cover their people. My plan is, government is doing well, has done very well. I am going out, pricking the conscience of the rich amongst us. How many can you cover, Chikwe? You will see me in big churches, big mosques. You will see me in the palaces of our emirs and our obas all across the nation. Asking people, let's pay for our people. What can you do? Accountability, increasing coverage, and massive advocacy. And this is a great opportunity for me to tell you guys what I'm doing. We are here to make a difference, and we will. Thank you all very much.